does it make sense for me to do it myself, or should I outsource it and get a third party company to do it? Is that for existing practices, it is better for the team to be empowered and learn to do it. So you need to have someone within the practice that is able to do this. And even if you were to hire a third party company, most insurance companies are now making it more difficult for them to um, negotiate fees with a third party company. So for me as a company, as an independent company, to come in and try to negotiate the reimbursement for your practice, it's a little bit more challenging because they're always one step ahead of the game. So they understand by consultants, we get access to fees from many different practices, and we are able to then help them leverage and say, okay, I got fees from this other office, and that is meant to be kept confidential. So now what they're trying to do is keep the confidentiality by only dealing and discussing fees and negotiating fees directly with the offices. So the approach that I'm taking right now, it's that I have a done with you approach instead of a done for you, just because I have friends that I've known in the dental, agents that have been working in the insurance companies for over 20 years. And they tell me, Maritza, when you have a client, just coach them through the process, but the emails need to come from them. So to answer your question, if you are an existing practice and you're looking to renegotiate your fees, your best approach is to empower your team, someone within yourself as the business owner, that's your responsibility, to develop the negotiating skills and understand how the insurances work and how they're interconnected so that you can take it and keep it in-house. And as needed, hire someone to help you and your team get coached through the process to make sure that you are taking the right approach, and so that you are able to navigate through all of the different options that there are available for you.